Now, adjuncts are a critical practice for anesthesia, and they will cause GI motility, PONV, anxiety, analgesia. Now, GI medications: H2 receptor antagonist, ranitidine, and proton pump inhibitor omeprazole help to reduce gastric acidity and event of aspiration. Non-particulate antacid sodium citric acid, occasionally they are given to increase the pH of the stomach. These are used in the obstetric population going to surgery. A dopamine receptor antagonist, metoclopramide, can be used as a prokinetic agent. Medications for PONV. PONV can be a significant problem during and after surgery. Both for the clinician and the patient, risk factors for PONV include female gender, non-smoker, use of volatile and nitrous anesthetics, duration of surgery, and post-operative narcotic use. Now, histamine receptor antagonist, 5-HT3 serotonin receptor antagonist, ondansetron, are commonly used to prevent, and they are administered towards the end of surgery. Caution is advised in patients with long QT intervals and ECG. Now, anxiety is a common part of surgical. So, benzodiazepine, midazolam, diazepam, alpha-2 agonist, clonidine, dexmedetomidine, and H1 receptor antagonist, diphenhydramine, they can be used to alleviate anxiety. Analgesia. Opioids are the mainstay of the anesthesia for pain control. NSAIDs such as ketorolac, celecoxib, analogs of GABA, gabapentin, pregabalin, they are all used for analgesia. Now, some of the functions of adjuncts anesthesia. Now you can see here. Relieve anxiety. Benzodiazepines prevent or neutralize gastric. H2 blockers prevent allergic reaction. Antihistamine, corticosteroids prevent post-operative nausea, vomiting. 5-HT antagonists or other antiemetics provide analgesia. Opioids and multimodal drugs stabilize hemodynamics. Adrenergic, anticholinergic, or hormonal, facilitate intubation and relaxation. They are neuromuscular blocking agents.